Welcome to Resiliency Within. I'm Elaine Harris, coming to you from sunny California. Well, today I have a friend and a colleague, Dr. Ingrid Duva, who will be sharing her work with us. And before, I want to tell you a little bit about the show, and we're going to talk a little bit about COVID. So, we've seen an uptick in COVID-19 over the last few weeks. In fact, my husband got COVID and we've been working real hard not to get it. And he got it when we decided to go on our first trip. But I've been talking to people all over the country that are saying, oh my goodness, we got COVID. We got COVID. I have a good buddy that's a doctor at a local hospital, and she tells me that there's more people again sadly in their intensive care unit. And I guess some of us kind of are living with an illusion that maybe we're over it, but obviously we're not. And people sadly are still getting sick from it and they're still dying. So I think that the strain on the healthcare system, as we know, has been unprecedented, and that hasn't necessarily gone away. So COVID-19 exacerbated the stress and trauma universally, creating a secondary pandemic that increased demand for mental health care in a system on the verge of crisis. So an intense and immediate need for population well-being support resulted, and subsequent requests for resiliency training quickly followed. And, we certainly have seen this all over the country, but there is a special group in Georgia. And in response, Dr. Ingrid Duva, my guest today, and nurses in Georgia certified to teach the community resiliency model that we've spoken many times about in this program. And for those of you that are new listeners, I'll tell you a little bit about what that is. But they fast-tracked bringing community resiliency model skills because they wanted to share this really mental health wellness training program across their state. So this successful nurse-led response to the crisis capitalized on statewide organizations' existing efforts to bolster well-being and reduce trauma. Partnerships were formed, and she's going to tell us a little bit about that because systems change really involve partnerships. And so she's going to tell us a little bit about that and the joint aims that were identified to disseminate the community resiliency model as the self-care modality. That means anybody can use it to individuals in an organization and communities throughout the state. So an evaluation of this program was recently published, and I'm so proud of you. Congratulations, Ingrid, in the American Journal of Public Health, a very prestigious journal. So Dr. Duva today will discuss the results of their efforts and the implications to the well-being of frontline workers nationwide, because there are more than nurses that are frontline workers. I mean, they have certainly bore the brunt of it, but there's doctors, people that work in hospitals, police officers, fire, grocery store workers. I think about them. So I want to tell you a little bit more about Ingrid. She is Dr. Ingrid Duva. She has her PhD. She is also a nurse. She's an assistant clinical professor at Nell Hodgson's Woodruff School of Nursing, Emory University. She also serves as faculty for the Quality Scholars Fellowship with the Veterans Healthcare Administration. In addition to being a certified CRIM trainer, Dr. Duva has advanced training in quality improvement, implementation science, and leadership. Her clinical background is acute care pediatrics and school nursing. As a health service researcher, Dr. Duva's studies examine the role of nurses to care delivery and their relationship to the work environment. So the community resiliency model, for those of you that are new, is based on cutting-edge neuroscience and teaches 6 wellness skills to restore the mind, body, and spirit to well-being during or after a traumatic or highly stressful experience. So it is biologically based, educating about the autonomic nervous system and how the body responds to stress. And it can be learned by kids, by teens, by adults to stabilize emotions and their nervous system and their sensory system, resulting in more adaptive thinking when facing emotional or physical distress. So CRIM has been used across many cultures, and we train natural leaders of communities. And we can talk a little bit more about that as we talk to Dr. Duva. So Ingrid, welcome.
Hi, thank you for having me. This is my favorite podcast, so I am honored to be a guest.
Oh my gosh, I love that. I think you're the first person that's ever told me that yet. So, oh my gosh. So, that brings some warmth to my heart. So what's on your mind today as we get started?
Well, I am squeezing this in between work, and we've been invited to introduce the community resiliency model to the campus police here at Emory and some of the other locations that the security and police cover, which would be Grady Hospital, and Emory has a Midtown location, but we're going to be meeting with them at their shift change this evening. So between 6:30 and 7:30, and they're giving us about 30 minutes. They want to be introduced to the model, and I am tossing around in my mind, how am I going to share what I would like to teach in a week in 30 minutes, just to let them know what it is so that they can come back to us to get more information. So I'm thinking of that hook that I need.
That hook, or that, I call it an appetizer, so
Yeah,
that you're going to come in. But anyway, oh my goodness, thank you so much. We feel that law enforcement certainly is in the front line, and to be able to support them in any way that we can right now, because they're facing a lot of difficult things. And also, when we think that law enforcement can be in their zone of well-being, then perhaps then when they're making decisions, that they will treat people all with respect. And because I think sometimes when people are bumped out of their zone, including law enforcement, is when the troubles and the challenges happen, when they may have responses that results in the injury or the death of someone that didn't need to happen. So thank you so much for doing that. So you're doing that right after this. So you have a busy day for yourself out there in Atlanta, Georgia, where you live. Well, why don't we start a little bit, because Ingrid, you're a nurse. And what called you to nursing? Can I ask you that first? What called you to nursing?
you can ask me that, but it's not that interesting of a story. I would tell you that I was at the university studying my first 2 years, and I've always been very interested in health and wellness, however. And so I was looking at one of the health professions, and like many listeners, my mom's a nurse. And so it felt a little bit familiar. And I thought, these classes look great. I'm interested in health and wellness. I want to help people. And truly, I mean, as a 19-year-old making that decision, probably not the right thoughts went into it, but I will say it's been a very rewarding career. And I would promote the profession, as hard as it is for anyone, because I think there's so many different ways that you can actually be a nurse. And so we've kind of got that broad reach. So here I am, still a
Well,
nurse
and
31
was
years
your mom
later.
happy that you decided on the profession, or did she say, "Are you sure, Ingrid, you want to do this or not?"
She did say, "Are you sure?"
She did.
She
Well,
did say, "Well, I'm not a blood and guts person," and she knew that I had been there on those nights. I remember she used to work the evening shift, and she would come home late at night and would not be able to go to bed because she had to kind of de-stress from her shift. And so she just said, you're picking a hard job, so just know that."
well, isn't it interesting that she had a hard time de-stressing, and you're working in the field to help nurses de-stress with the community resiliency model? So that's actually kind of an interesting story, Ingrid. You probably have to maybe reframe that experience. But
Right.
you not only are a nurse, you are a nurse practitioner. Is that correct? Or no, you have your PhD in nursing. So
Yeah, so I
yes.
I do have my master's, but I went into, and it probably connects, it all actually connects. When I got my master's degree, I went into management, leadership, and health administration. And I think the reason why is I was looking for my best fit in nursing. And as opposed to taking care of the patients, I really wanted to take care of the staff and create a work environment where the staff could be their best selves, and the best nurses would really sort of rise to the top and have opportunity to make a difference in patient care, because there are some amazing nurses out there, and we just need to keep replicating those.
Well, I love that you found the right place for you, because I think when maybe people are considering a field, maybe they think nursing is only bedside nursing, but there's many, many opportunities within nursing to do many things. And so you went on to get your PhD, and you're
Correct.
bringing that leadership now into many, many different fronts with the community resiliency model, and I imagine other things that you've done in your professional career. So did you get your PhD because you wanted to do the leadership piece? Is that what, because that's a lot of work, Ingrid.
I
Yes.
know. And I'm not sure if I could do it again, knowing what I know now, but I actually was already in leadership. I had been in leadership at the Children's Healthcare Organization here in Atlanta, and went into an internal consulting position, so that I was traveling to hospitals all over the country, doing some management training, doing some customer service education, working with the staff. And I went back to get my PhD purely because I was often the only nurse in the room making decisions about resources and how the work and how the processes would work, and what the nurses needed to get their job done. And I felt like I guess I didn't feel confident enough that I could articulate the contribution that nurses were making and what they needed to make that. So I thought, oh, I'll go back to school and get my PhD and take a break from work. But that
And here
was
you are now. But now the other thing is that you became a community resiliency model teacher, and that's also an extra certification. You didn't have to do that. What called you to do that extra certification to become, as we say, CRIM certified?
Well, I do like to learn new things, but this was purely a selfish endeavor when I saw a flyer hanging in the elevator at my job, which was at the university at that time, for a resiliency training. And being a mom of 3 kids, I had read that, if your children are resilient, like that's highly associated with success in life. And of course, as parents, we all want our children to be successful. I said, I have to learn about this resiliency. And this was about 6 years ago, maybe 5 years ago. And so I was like, I'm going to go to this class and learn about resiliency so that I can be a better mom for my kids. And I went to the class, but it wasn't what I expected. It was nothing what I expected. But I did approach the instructor, who's Lindy Grabby, and said, this is the most amazing set of tools. We need to get this into the kids' schools, because I saw the relationship to sort of the resilient zone and, emotional regulation, which is such a challenge for children in school. So that's how I got hooked.
So so Ingrid, did you realize you were going to get another additional career when you first met Lindy, and then we met? So it's gone a whole interesting way for you, hasn't it?
It really has. If you just go through the doors that open for you, is what I've learned. I mean, the paths can take you many places, but the pandemic accelerated my work with CRIM, of course,
Yes, yeah,
because there was a need for resiliency training, and people were looking for opportunities to, manage or increase their own resilience and manage the stress. And I mean, that's how this all came about, is we had to figure out a way to deploy the skills and training and information as fast as we could to respond to all the requests.
yeah, and the need. But I want to also just say one thing, and we'll continue with another question, and that is that we've had a few conversations getting ready for today, and one of the things that I'm very touched about is just you saw this for yourself as a mom, and that you wanted to do whatever you could to bring as much wellness into your family. And I think that really is one of the core values of the community resiliency model, that it's not only for nurses, but it's for you as a mom, as a partner, as a member of the community. And so I think that that's one of the I was inspired by the article that was just published for the evaluation, because I think what happens in Georgia could happen in other states as well. So anyway, I just want to do a shout out to you, and all your kids should surround you with just love for knowing that their mom is always trying to create a better world for them, even though I know at times when they enter certain ages, they may not have that same demonstration of appreciation, I'll say. Yes, you know exactly what I mean, right?
Well, I did make them take the class when I was in training. They had
Oh,
to
you
be my
did.
subjects.
So do
Yes.
they use the skills at all, or do they say, Mom, you're not in your zone?
Well, they know about the flipping your lid for sure. They like that one. Yes.
That's great. Well, that's good. I think we borrowed that from Dr. Dan Stiegel, but it's certainly a useful tool of helping people understand about the neuroscience of how sometimes, like, we lose our head, but we can get back our head
Yes.
and act from our best self, which is kind of a core concept of the community resiliency model.
Absolutely.
So let's talk a little bit about what prompted your group, the CRIM certified nurses in Georgia, because it's not only you, it's Lindy Grabby, it's Jordan Murphy, that you 3 are kind of like a core group. I know there's others, Marianne Bard and others that have worked as well, to fast track the efforts to spread CRIM across the state. So can you talk a little bit about that partnership and why that's been important, and so we can kind of understand what y'all have done?
Well, I think Lindy was the first person in Georgia to implement a research study looking at CRIM and the outcomes to try to demonstrate really the positive outcomes that we all had a hunch were there. And so she had already worked with nurses at Emory Healthcare, at the Emory Healthcare System. And so we were working with Lindy, and we, of course, were already collaborating, those of us that were CRIM teachers, and it's more than just nurses that are CRIM teachers in Georgia, but trying to stay connected so that we could help each other with trainings. And so we were already in discussion with organizations like Resilient Georgia, who is a nonprofit organization that is really building a pathway to resilience and trying to make it accessible to all, primarily children in Georgia. And then those discussions were in place as COVID hit. And so we talked about that sort of increased demand with them and the need to get the CRIM trainings out to people and make it accessible to everyone, which means we needed funding. And Resilient Georgia was so supportive from the beginning, providing us relationships to their grantees. And so that we had a mechanism to provide training for people just to attend from the different communities. And at the beginning of COVID, the Georgia Nurses Association had reached out to us to say, we need to do something to support nurses and support the whole state. And we're interested in what you're teaching. And so we formed a relationship, sort of a three-way relationship with GNA and Resilient Georgia in order to create a network. And we felt strongly about reaching everyone in Georgia. So we have 159 counties, and most of Georgia is rural, even though, because a lot of us live in Atlanta, we forget about the rest of Georgia.
Yes,
but
right.
that was really important to us. And so to kind of increase our reach, when our three organizations got together, we had that capability, and we could meet directly with community leaders across the state and, find out what they needed and what they were interested in, what groups they were prioritizing, because some communities, it was their police department. Some communities, it was the hospitals, because they were inundated with patients and they couldn't handle the flow, and they couldn't even take patients, and the staff, sort of were at their max and stressed. And in some communities, it was the children. We've worked with the juvenile justice system, and then we did a lot of work through educational organizations, because in the schools, the teachers are also frontline workers.
Yes.
And they were doing amazing things to keep kids staying connected to education. And they were putting themselves, it felt like, at risk as well, still being out there. So yeah, it really, once we identified that we had the same goals and we had different things to offer and different strengths, and sort of put that all together, looking back now, it's pretty amazing. At the time, we were so caught up in the work and getting it done, but now it feels pretty good to see how many people we actually touched in Georgia. And thanks again to those other organizations.
Well, and I think that, when other communities may be listening to this, and individuals from other communities, really, because we have a worldwide audience, I think it's really important to underscore what you all did, because you brought important community stakeholders into the conversation. The Georgia's Nurses Association, Resilient Georgia, the school districts, Emory University, one of the most prestigious universities in the country, really. And so the fact that you had those, those players in, also gave you more credibility that what you were doing could be not only accepted, but also, oh, we need to listen to these folks. Because maybe it would be helpful at this moment is to just share, what does CRIM do that why do people need it? I gave a little brief description, but you've been evaluating this. And what does it do that helps people, that why it's important to learn it? It doesn't take a long time to learn the skills, as we know. But what would you say about that?
Well, I guess what I would say, and again, this is one of the reasons why I was so eager to learn and share the model, is they're tools. So we've learned about things like emotional intelligence and emotional regulation and managing our stress, and how to control our thoughts and our feelings. I will say that what is new about CRIM, or the community resiliency model, or what I feel like is sort of underrepresented in other models, is the sensations. So the sensory well-being and using tools to tap into our sensations to grow our own well-being and sort of our threshold for resilience. So what CRIM is it's like a how-to. So we can talk all day about what we need to do. And I'm an academic and I love to analyze why and how things are occurring and what's the logic behind it and what came first and what came second. But none of that matters if you don't have, I think, a tool to walk away with. And I think I bring that forward from working in management when I was teaching nurses on the job.
Mhm.
They wanted to walk away from a training with something they could do differently. It's a little bit different when you teach in academics because we get into the theory and everything, but I do think people appreciate that they walk away with something they can do for themselves and for
Well,
their clients.
and frontline workers are kind of action folks.
Right.
They're not
Yeah.
like, okay, we can hear the academic theory, but just a little bit. But we want to know. So give me, it's kind of like in that movie, who was it? Gooding said, "Give me the money." Right?
Yeah.
Give me
Show
the
me the
juice.
money.
Yeah, show me show me the money. Is that they really want to see what are the skills that are going to help me restore that balance within my nervous system. And just talking, yeah, you can talk all you want about, yes, there's all these statistics about, yes, nurses are stressed, yes, law enforcement stressed, yes, all the first responders are stressed. Okay, so now what? Well, so we can, we know that certain things like exercise can be helpful, but if you're too tired even to exercise, how are you even going to make that happen? So if we have something that we can be that first kind of level of intervention that's easy to learn, how might that affect, the entire community? So I guess that's the proverbial question, right?
And the other important thing that I know you make this clear to people too, but I think that they respond to is that this is not CRIM is not replacing something they're already doing. I mean, people are already tapping into their resilience. That's how we're all surviving these last few years. But it can, right alongside it, it can just be another tool in your toolbox that's so easy to access in the moment.
And it can amplify, I think, the
Yes.
also the resources and strengths you already have, because oftentimes we think or we feel about it, but we haven't sensed it. So if we say, oh, I love walking in nature, and I'm thinking about the last time I was in the woods and there was a stream, and I'm going on and on. But if you said, oh, Elaine, well, what are you noticing on the inside? And I'm going, I take that deep breath, the nervous system's restored, right? You can get not, but it's can be somewhat restored by just thinking about it, but it amplifies. It's like savoring it to your hard drive, right? When you sense it. And that does seem to be the secret sauce in the model that's so easy to learn, and why children, teens, and adults can all learn it, in a very equal way. So I'm just wondering, as you bring it forward, are there things that have been challenges? Can you share some of the things that oh, I didn't know this was going to happen? Or there been stumbling blocks to people learning it or not in your experience?
I have not, again, another strength. I know it sounds like I drank the Kool-Aid, but another strength of the model is that I have not run into people having difficulty learning it. The only barrier that we have found, and this is, I think, kind of classic of those of us in the helping profession, is sometimes people resist the self-care piece.
Mm.
If you're teaching it in terms of how a nurse can help their patient or how a teacher can help their students, their mind is more open. But often when you talk about what we need and reaching deep inside, that can be hard for people.
Well, and I just know so many nurses that have been some of my dearest friends and colleagues over my whole professional career. And I think this is true of social workers, which I'm one, I think, is that we're really good at taking care of other people. We're good at it. We've got it, but not so good about saying, pause, how are we taking care of ourselves? So I think the other part that has been shared in the research is that you can integrate it pretty simply into your activities of daily living. So it's not something you necessarily have to say, I have to go to a quiet room to do. And do you think that's one of the benefits for nursing, that it is kind of so accessible in that way?
Absolutely. And I think the nurses actually told us that, starting with Lindy Grabby's first study, when the nurses reported how they were using the skills, it could be as simple as, counting their steps as they walked into a patient's room to make sure that they were in their resilient zone before they began the patient encounter.
Yeah, so some of those very simple things, I think, because nurses and frontline workers are so busy that you don't have to go someplace else. You can do it in the present moment. Because I think there is that kind of dosage of well-being, is that if we don't do that, like counting the steps, for example, and you just get stressed and stressed and stressed, it's like pretty soon you fall over the cliff because you can't keep doing that. And I think, there's many factors about, the stress that healthcare workers have experienced. But I think there was just too darn many people that were sick and dying for how much the staffing that was available, because we weren't prepared for the kind of pandemic. Would you say that was true?
Absolutely. And then the resource issue where the staff didn't have the supplies and the equipment that they needed, which has always been there to some extent, but the pandemic just exacerbated. And a lot of systems can work broken if they're not pushed to the max, but once they're pushed to the max, that's when you see that breaking point.
Right. And I think this is so important right now because we know that there are many nurses that are leaving the field because they're done. It's been too much without enough support to be able to continue their job. So this is also something we're trying to do, say, well, what if we have these doses of well-being? Could that keep you in the profession that you've started out with, that you truly loved? Well, we're ready for our break in just about a minute or so. And we are going to be coming back and talking to Dr. Ingrid Duva. She's going to tell us what she found out when she did the evaluation that was published in the American Journal of Public Health. So we know a little bit more about, well, if we want to do this in our own state, in our own community, what in the heck did they do that was worthwhile? I always say worthwhile enough, Ingrid, to get published in the American Journal of Public Health, because I mean, I was very excited to see that you all had done that, and that people are listening to what you're doing. And I know the three of you and many more are working very hard to accomplish this. So we will be back in just a couple minutes after we hear from our sponsor, the Trauma Resource Institute, and we will continue our discussion with Dr. Ingrid Duva from Atlanta, Georgia. Welcome back. I'm Elaine Miller-Karras with Resiliency Within. I'm talking to Dr. Ingrid Duva from Atlanta, Georgia, who's been leading the community, one of the leaders of the community resiliency model workshops that have been spread throughout the state to increase well-being in entire communities, but including our frontline workers. So I'm going to ask Dr. Duva right now if she could talk a little bit about the study that was published in the Journal of the American Public Health about the evaluation of CRIM. So if you could tell us a little bit about what you studied and the outcomes and what you see as the projections from the study that you did, that why it's important and why they just, they decided to publish it, obviously, because they think your findings, your evaluations are important for us all to know about it.
Well, before I start, I will say that we have done some randomized control trials with CRIM, so that we're really trying to isolate the model as an intervention to see, to make sure it's not confounding issues that are all to attribute improvements that we consistently see with CRIM. But this particular article focused on our response to COVID and to all the resiliency requests and spreading it across the state. And what our evaluation, I think, shows, and the reason it was published is that as nurses, we were able to reach cross-sector and build partnerships with very influential organizations who could reach all the people we were trying to reach across the state and help us take a model that's so flexible and adapt our training to meet the needs of the people in their local site. And I will say, thank goodness for, things like Zoom and Microsoft Teams, that we're able to meet with people during the pandemic and we don't have to be in person. So we had that option, and we found, as you know, because you took your trainings virtual, you flipped to
Yes.
virtual with
Yeah.
COVID. We were very pleased with the reception that all of our participants had to using Zoom or being virtual.
Well, and when you talk about too, a state like Georgia that certainly does have metropolitan areas like Atlanta, but you are really a rural state with so many different rural counties, right? So that when you are on Zoom, it really does increase the accessibility for people to attend that otherwise may not have been able to attend because of just the distance and all the difficulties that happen when you live in rural America.
Well, I mean, and the success of teaching CRIM through Zoom, um, I mean, we attribute that to a lot of our success in reaching the rural areas because it made it feasible. Like we,
Yes.
as instructors, I mean, once you learn CRIM, it's great because you can start using the skills and sharing it with others and guiding others, but we still are all certified, those of us who are teaching large groups. And so it made it feasible for us to reach people without having to get in a car and drive to Brunswick, Georgia, which is on one side of the state versus, Bainbridge, Georgia on the opposite side of the state. And so there we were able to reach people, and we had very positive evaluations of the Zoom sessions. We were able to deliver them in short increments of time as needed. We always promote longer amount of time.
So what was
but
how long were the workshops that you did?
So we designed it so that we would deliver 3 different times a 1-hour session so that participants from that local area or region or organization had options for when they could attend, and we would introduce the model in that 1 hour. And I think that one part of CRIM's success has to do with the receptivity of people who attend the sessions, because if you're attending the session, you're interested in it, and
Right.
it is easier to, I think, learn and adopt the skills into your own sort of lifestyle
You
or
already have a motivated learner. I mean, that does always make
yes.
a difference, doesn't it? Yeah.
It does, and I think that's okay because we want to meet the motivated learners' needs, and along the way we always pick up some people. But after attending that introductory session, we invited anybody who wanted to come back to a 3-hour workshop, and so I think we got more people back to the 3 hours that way because when they attended the 1 hour, it resonates with you, and you see this potential, and so you want to learn more. And just like anything else, a little bit of repetition is good, right? So we learned that way, and we could go into more depth in some areas of the model and more practice so that people could practice using the skills with themselves and with others, and we could give feedback, all possible virtual. We still teach in person, like later today will be in person with the campus police, but these sessions during the peak of COVID were all virtual.
And the ones that you talk about in the evaluation. So did you find that there was, I mean, did you evaluate if there were changes in people's well-being? Was that something that you looked at as well? Or did you evaluate just if they liked the training or not?
So we have done evaluations, checking people's pre and post well-being scores, anxiety scores, team relationship scores. I've done that with some of the hospital staff, but in this particular evaluation that was published, it focuses on if people's response to the training, if they felt like it met their needs, if the trainers did a good job reaching them, what they learned from the training, and then what skills or what they used from the training afterward. So again, it was more about the deployment of the model and whether or not it was effective than the change that we see in people, the
Right.
specific
And
change.
so what did they say about what they were still using? Like what was the outcome for them after they learned the skills?
Well, we had a lot of different responses, but we did find that most people were trying to use the skills even just after an hour session. And most of them would talk about sort of that reminder to use skills that are easy, such as grounding or gesturing. And many people will talk about developing their own resource and how they found that was actually going to be very useful for them moving forward. And then a lot of people responded, just how easy it was to learn and how excited they were to have something else to do to support their own well-being.
Well, and I love this. I love that they said they were excited, because if they were excited to have something, that means that there's a higher, I think, possibility for them using those skills down the line. And also, we always say that when we do a community resiliency model workshop, we're creating CRIM guides, not only guiding yourself to your own well-being, but you often share it with your partner, your kids. And so it begins to spread. Now, because have you shared the skills with your kids? I think you have, haven't you?
Yes.
Yes. And so there's parts of it that they still hold on to.
Yes, more or less resistance depending on which child, but yes, they.
Yes. Well, I just love that you started learning this for your kids, and that you actually taught your kids this as well. Well, so is there anything that you think is really important for our listeners to know about the piece that was written in the Journal of the American Public Health Journal?
Well, I think I talked a little bit, or maybe I haven't, about the ability to adapt the model to meet, whatever the local need is, depending on who the participant is or who the organization is or community. But because of the timing for most of this, I think one thing we tried to emphasize was because in addition to COVID, we had, the social justice movement sort of.
Well, and you had some serious things in Georgia. That was Mr.
Yes.
Maubrey who was murdered from Georgia.
Yes, we had that. And just being in healthcare, seeing the disparity in outcomes in COVID, and, you know, raising the issues that needed to be raised, but it was very polarizing. It was also, we had an election that was very polarizing. So there was a lot going on.
And
where
Georgia was kind of like in the center of it, still
Yes,
is.
we were. We
Yes,
still are.
and still are, yes.
But what I think what it brings up are these behaviors that we just were so appalled by, many behaviors. And I think when we're teaching the model, one thing that was eye-opening for many people is just the understanding of these behaviors that are really because we're out of our zone, right?
Yeah.
And so if we can recognize why people are behaving in such a way, and we talked a lot about compassion and how important it was, to understand it and recognize it, as opposed to just react to it.
Right.
So, I think you say it a lot. There's that, between an action and a response, you have the space.
Right.
You can choose how to respond.
Yes.
So
I think we help people learn how they can find that space, because otherwise it's just so reactive, right? So they can like pause, sense that leaving little moment of well-being and say, okay, I'm going to say this instead of that. This is going to get me in way trouble. And this is going to be maybe bring us together so we can have a conversation.
And for our participants, that the whole idea of what else is true was so important, because we can get consumed by everything that is happening around us. When you go to work and it's stressful, and you come home and it's stressful, and you turn on the news and it's stressful, and just finding that what else is true, because it is out there.
Yeah, so just so that you know, that in the community resiliency model, I often say what else is true is that there can be a lot of chaos, but then what else can we say exists? Oh, I have this really strong friendship with the colleagues that I work with on the unit. Or that one time we were able to save that one person that we thought that person would never be able to survive. And so when we amplify those stories of hope, it does have a way of increasing our empathy and compassion. And also, as we're seeing in some of the outcomes of the research, the randomized controlled trials, is that there is an increase in well-being, which means, connections to our compassion and our empathy, self-compassion, and how we look at others. So I don't know if you want to talk a little bit about that, Ingrid, because that always just really is so touching to me, that is a side product of what we do.
It really is a bonus, unintended consequence. I guess as I sort of saw that play out, but absolutely. And I think it's just teaching people that if we're practicing the skills, even in times of, no stress, every moment that you're in your zone, you're building your resilience, right? And so, in the same way that we're trying to broaden that resilient zone, we are sort of broadening our tolerance or our receptivity to people's behaviors and our understanding.
Yes. Yeah.
And we just really need compassion right now. I think, I don't have the answers to some of the issues, dilemmas that we're in right now, but
No.
definitely the compassion piece is, it's important for us to grow.
Well, and if we don't have the compassion, it's hard for us to even listen, isn't it? Of,
Good
oh, what,
point.
yes, what is it that they're saying? That's our personal lives. I mean, we've all been in situations in our personal lives when our compassion was missing. And all of a sudden, oh, good, we found it. It's back. How do we gain it back when that happens? I think, I like to say that the community resilience is a very human model because it does acknowledge that sometimes we're not our best self. And that doesn't mean that there's something terribly wrong with us. It means there's something terribly human about us. But the point of it is, do we continue to be taken down like the river, of despair, sorrow, violence? Or do we say, wait a second, I can pause. I can do something differently. And, we see people that, reclaim their lives after being imprisoned and maybe did horrible, heinous acts and then say, I will never do that again. I'm always interested in what is it about us as human beings that even when things are really horrible, and maybe we've done a really horrible thing, that we can stop and repair. We can ask for forgiveness. I always think that forgiveness is bestowed upon us. Not everybody's going to forgive us for some of the acts that we do that may be unforgivable, but we can certainly live in a different way. And that's what I love about, you working with the juvenile justice system, because you're talking about a lot of kids that are in a system. And I imagine that the ratio also, when we look at the racism that exists in the United States, is that there are many more kids of color that are in your juvenile justice system. And so how do we mitigate that? How do we change that? And I guess I get hopeful that when you're out there doing what you're doing, maybe this is one of the ways. I don't know. I'm getting really philosophical now, Ingrid. What do
Well,
you think about what I'm saying,
I will say that, part of our a point that we try to make, and every time we deliver a training, is that we do need more teachers because we want to have certified crim teachers that can relate to all different groups. And certainly, yes, my colleague Lindy is a few years older than me. And if we're teaching kids in the juvenile justice system, I mean, I'm not sure how well they relate to us. So, and Lindy does a great job sort of recruiting people and supporting them to train as trainers when they can relate closer. You want to sometimes be taught by somebody
Absolutely.
like you.
Yes. I mean, so we've actually worked in Georgia. Lindy's been such and so has Jordan in terms of Covenant House, and we've trained
Yes.
some of the youth there to be crim teachers. And we're also now developing a youth ambassador program that will be done by January. That will be a more truncated, shorter program for youth that will be something we can use for teenagers. So that's coming in the future. But if people are wondering, how do you become a certified community resiliency model teacher, you would contact our sponsor, the Trauma Resource Institute, traumaresourceinstitute.com, and you can learn all about becoming a crim teacher. And also, I just want you all to know that, there's a cost to it, but we also do have a scholarship program, and you can apply for a scholarship. And we really try to make those work depending on what part of the world you're in and what you're trying to do in your particular vicinity. So, don't be put off by that. Just say, okay, well, maybe I can figure out to get a scholarship to become a crim teacher, because we've certainly given plenty of scholarships to some of the the kids at Covenant House and other. We don't want it ever to be a barrier if you want to become a crim teacher, and if you don't have the funds, that we will try to see what we can do to work with that person to become a teacher. Well, so, one of the things I want to make sure we talk about before you leave today is there's a study that's not yet published. This is your, I don't know if you have a publisher in the wings yet, but I'm hoping that you
It
will
is
soon.
it's in review. So
It's
we'll
in
see.
review.
Yes.
Okay. Amen. Hallelujah. We hope it happens. But there's been some really interesting outcomes from that study that I actually was so surprised that, of course, it was only an hour. So we wanted to see whether only an hour of learning crim skills had an impact. So Ingrid, tell us what you found.
Well, we found significant positive improvements in well-being, and we used the WHO well-being scale, which is a 5-question scale. And so we did see significant improvements. We saw significant decrease in secondary somatic stress symptoms. And another, I think, most important finding from that study that I was specifically involved in because it was with healthcare workers, we were interested in sort of their engagement in work and their relationships with their co-workers, because that is so important to quality patient care. We know if we have mentally and physically healthy caregivers, that the care they're giving is better, and we've seen that. We have studies that show that. So we looked at team relationships and before and after the training, and again saw a positive improvement. And so that was, I don't want to say a surprise, because we had gut feeling that it was good for social, pro-social
Engagement, yeah.
yes, exactly. But we did have significant findings in that. And then we use a scale, the MAIA, which is really, it's a subscale from that, where we just try to identify if we've actually taught our participants to sense in. And so we saw that we had positive or increase in those scores too. So the ability to sense in and increase your sensory awareness from the training.
And I just want to underscore the importance of that, because there's a whole body of evidence that we've spoken about and mentioned on the program before. It's called Interceptive Awareness. And when you're able to do that, you have better affect regulation, control of your emotions, better impulse control. And so if you have better control of your emotions, even if you're having a problem with a colleague, right, you can get back into that zone and have a conversation. So that is exciting that there was greater sensory awareness, because we haven't really looked at that in that much detail yet.
Yeah, so those are our results, and our study. I will say that one of the challenges with the study, it was during COVID. I think we had over 250 people register. We split them into, control and intervention group. I think our biggest challenges was getting people to the training.
Yes.
Because you're always fighting with people's time and other priorities. But once they came, our results were really positive.
So let me ask you this now. So here you've been doing so much. So what's next? What are you going to be doing with the community resiliency model in the future? Because I understand there's a pretty exciting grant that you're working on at Emory.
Yes, I am supporting a grant that the PI's name is Nick Giordano, and he has this HRSA grant, which is the Health Services Research Administration. They have funded this well-being work for healthcare workers, particularly interested in those who are working with vulnerable populations or the underserved. And so our work, and there are other organizations that have been funded for this also, but our work focuses on Metro Atlanta and the healthcare workers, and we're disseminating trainings. And it's a 3-year grant, and we will be sending people to the Trauma Resource Institute to get their certification as trainers.
And yeah, I think that's happening at the end of August. So that's coming up. So we're really excited about that program. And I also want to let our listeners know that there are 3 other, University of Alabama, University of New Mexico, and Children's Hospital Los Angeles that all got similar grants. They're all doing something a little bit different, but they're all using the community resiliency model. So we're hoping that we're going to get a lot of good findings from that. Ingrid, our time has slipped away so quickly. We're almost done today. Any parting words that you would like to say to our listeners that you would like to emphasize?
Yes, 2 things, and they relate, and that is that the publication that is in the AJPH does focus on the ability for nurses to lead the dissemination of CRIM, and I think that that's important, that we're not claiming to have special training and therapy, but we are able to reach people because of the work we do. So we felt like that was a good add. I know that you're a social worker, but we want to reach all of people, and address the total patient, so to speak. And I wanted to give a shout out to CAPN, which is the Community Advanced Practice Nurses here in Atlanta. It's a nonprofit, and they were really the first nursing organization to sort of run with CRIM, and they've been teaching it to the homeless population for several years now, and I think they're making a big difference in our community.
Oh, that's so great. And I'm so glad that you mentioned, both things. And also, if people want to get a hold of you, how can they get a hold of you? Can you tell us a website?
Yes, we have a website called CRIM Georgia, that's CRM Georgia .org. And I encourage you to check it out. We have a lot of our information and trainings on there. And Dr. Linda Grabby, Dr. Jordan Murphy, and myself, we have our contact information on there and sort of what populations we specialize in. And we would love for you to reach out if you're interested in training or information about, and our studies are also listed there, the randomized controlled trials.
So from the bottom of my heart, Ingrid, thank you so much for the work that you're doing. You're changing the world. I'm sure glad you saw that flyer that one day in the hallway. That was some of the best information I've ever heard. And I'm just wanting our listeners to remember what else is true. You heard how important that was, but I think it's important for all of us when we have those moments of despair and darkness and saying, how am I going to get through the next minute or the next day or the next week? What else can be true in your life? And remember that, those things that help you get through and the people that love you and that you love. And sometimes things that are so simple, it could be your furry dog, or it could be your faith, it could be so many things. So Ingrid, thank you again. And until next time, this is Elaine Miller-Karras signing off from Resiliency Within. Thank you for coming. I hope you come back again.